Resources. All first aid equipment must be operated according to the manufacturer's instructions and never used for anything other than what it is intended for. There are essentially two main types of bandages. One is called a roller bandage because it rolls onto a limb. The other is called a triangular bandage. However, bandages can often be improvised as the situation demands, using clothing, blankets or other material. Roller bandages can be used for such things as holding dressings in place, helping to control bleeding, helping to reduce swelling and more. Triangular bandages may be folded to create an upper arm sling, lower arm sling and a collar and cuff sling. Providing first aid. An emergency can happen anywhere, on the road, home, work or play. The sound of someone in distress, a spilled chemical container, unusual behaviour and signs and symptoms of the casualty such as severe bleeding may be indicators of an emergency. An emergency action plan is a guideline a first aider can follow to assist them to remain calm but respond quickly and provide effective treatment. Following an emergency action plan can also ensure safety. A medical emergency is a sudden illness, such as a heart attack, which requires immediate medical attention. An injury is damage to the body, such as a broken arm, which results from violent force. Some injuries can be serious enough to be considered emergencies. Doctors ABCD is an acronym to follow in regards to the emergency action plan. D for danger. Identify, assess and manage immediate hazards. R for response. If conscious, obtain consent, assess the casualty. S for send for help. A for airway. Is the airway blocked? Open the airway. B for breathing. Is the casualty breathing? C for CPR. Start CPR if required. D for defibrillation. If available and needed, defibrillate the casualty. Understanding the body. A first aider must have a basic understanding of the anatomy, physiology and certain body systems. Anatomy. The study, classification and description of structures and organs of the body. Physiology. The study and processes of the function of the human being. Body systems. Cells combine to form tissues. Tissues combine and form organs. A group of organs combine to form a body system. A body system is a group of organs that work together to accomplish a bodily function. Vital signs. Vital signs are used to measure the body's basic functions. The normal ranges for a person's vital sign vary with the age, weight, gender and overall health. There are 4 primary vital signs: pulse, breathing rate, blood pressure and body temperature. Signs and symptoms. Signs are observations about the casualty's condition. Look for visible signs of injury or illness. For example, is the casualty pale? Is the casualty sweaty? Is the casualty bleeding? Symptoms are how the casualty feels. You can ask them to tell you what they are feeling. For example, are you suffering from a headache? Do you feel pain? Do you feel sick, dizzy and unwell? Consciousness. Conscious. A person is walking, talking, doing normal things is said to be conscious. Unconscious. A person is said to be unconscious when they cannot be woken from what looks like a sleep, but they are still breathing and they have a pulse. You cannot gain a purposeful response. Cardiac arrest. A collapsed casualty that is unconscious and not breathing normally or at all. History. History is the complete story concerning the accident or illness. What happened prior to the illness or accident can be vital when working out what is wrong with the casualty, especially if they are unconscious. Ask questions such as, do they suffer from any illnesses? Are there any previous or relevant medical conditions? Are they on medication? Medic Alert is a bracelet or necklace providing instant access to primary medical conditions, allergies or special needs. Multiple casualty incidents. Triage. Triage is a tagging system often used by paramedics. However, the principle can be applied in any situation with 2 or more casualties. Basic triage is the sorting of the casualties in a multiple casualty incident by the severity of the injury or illness. This ranges from those most in need of assistance to those who only have minor injuries. For example, those needing immediate life-saving interventions such as obstructed airways, excessive bleeding or shock will be treated first. Then those with a stable but need monitoring and medical attention. To those that will require care but not urgently. Remember, a first aider must always be concerned with their own safety. If you do not protect yourself, you can make the situation worse. Thank you for watching this video on first aid roles and responsibilities. Please remember that there is further information relating to this topic available in the PDF on our website.